now. Burnt out, abused and underpaid. Nurses are fleeing the profession in alarming numbers, with warnings Australia's healthcare system is on the brink of what could be a catastrophic shortage.
If we don't wake up and take action, we are headed for a crisis, absolutely.
It's an alarming exodus. New figures showing 75,000 Aussie nurses have ditched the profession since the COVID pandemic. Some swapping nursing for life as a barista, a firefighter or even a goat farmer. Nurses no longer willing to put up with deteriorating conditions, including patient abuse.
During the COVID pandemic was probably the worst abuse that I've seen. It would be stressed family members or stressed or sick, delirious or psychotic patients, and they like to take it out on you.
Nurses experience more occupational violence than police officers and prison guards.
Overtime and extra shifts are leaving nurses burnt out and dejected. 1 in 5 leaving after being denied leave during COVID.
It's distressing to know that you're going to be working 5 times harder than you should be.
Their demanding job made even harder by a lack of respect from some doctors.
I've had some abuse from senior doctors as well. They're often dealing with high-stress scenarios themselves, but they can take out that abuse on you.
Many say their average salary just isn't worth it. Nurses earning up to $90,000 a year, less than the $95,000 they could make as a librarian, or the $100,000 they could make as a warehouse manager, or the $145,000 they could make as a senior retail manager. And as the situation gets more and more dire, there are warnings the consequences for patients could be disastrous.
If we do not have enough registered nurses delivering care, it is well researched and recorded that the patient experience and the patient outcomes are affected.
We have to fit in doing the role of 2 or 3 people, potentially up to 4 people. And that means that the patients aren't getting the monitoring or the assessment that they need.
There shouldn't be a politician who could sleep tonight knowing that nursing is not valued and that we're heading for a crisis.
Well, joining us is Amy Halvorsen, a former nurse who left the profession about 2 years ago. Amy, what is it that drove you to quit nursing?
I think it was a range of factors, mostly the understaffing, the burnout, just the entire thing had changed. I quit at the time when the world opened back up and people were on holidays and we were in the hospital wondering what was going to come next and what the plan was. So I kind of asked those questions, got no real answers, and for me, I decided it was time to walk away.
We just saw some of the statistics about pay in other sectors. What sort of jobs are people leaving to go and do instead?
I mean, when you look at pay in different situations, if you look at a first-year nurse who's finished a 3-year degree and heading into a career for the rest of their life, they start at about $35 an hour. There's Audi warehouses that are offering people the same amount of money. So nurses can really just leave and do anything. I think that was a big factor I pushed when I left, and I mentioned it to a lot of hospital management, is we aren't uneducated.
Can I ask you what hospital management says to you when you make that point?
It's so heartbreaking to hear this. We weren't really aware it was so bad for everybody. Like, it was a real scripted rhetoric I got back from hospital management, unfortunately. But I don't understand how they can't see that.
Is it true that some nurses have even turned to sex work to make a living?
Look, to be explicit, you have to kind of look at it this way. In a health and safety standard, you want to take it back to New South Wales health and safety standards, both are totally legal or decriminalised industries. One, you're dealing with multiple people spitting at you, different body fluids, exposure, infection risks. Not only that, you need to be educated, knowledgeable, professional. I've had people say to me, I deal with 1 man, 1 body fluid, totally safe, screened, no abuse, totally worshipped, and I make a week's wage in a day. Why? Like, you have to kind of look at the way up of what these people are exposed to in healthcare. Why would they not leave and do anything else? Anything else, so yeah.
What kind of impact will a shortage of nurses have on patients, do you think?
Patient outcomes is going to be the key thing here. Nurses are the backbone of the hospital. Being understaffed means that there are patients who don't have people looking after them that need to be. As simple as being walked to the toilet, a confused patient can hit their head, have an injury, and it happened on our ward due to understaffing, due to all these kinds of things. Detrimental outcomes do happen, and I really think people need to be aware of why.
Amy Halvorsen, thanks very much for your time tonight. We appreciate it.
No worries. Thank you very much.